were not here during some of the earlier workshops, those counselors have all watched the video of the workshop to get up to speed on this issue. So syringe service programs, as we learned from our earlier discussions, are authorized by the state. While this is first initiated in the late 90s, several years ago there was an update when the current SSP program was authorized. At the same time, the legislature made some changes that removed the prohibition on purchase or possession of needles without a prescription, and on the use of drug residue from hypodermic apparatus to show evidence of a criminal drug violation. The SSP's program was just recently reviewed in the first regular session of the 132nd legislature, the current legislature, and the legislature expanded the authorization to include mobile SSP services. That's currently in rulemaking by CDC, and we would expect that rule to be promulgated on or before February 28. The legislature also took up another bill regarding the ratio change, and the legislature rejected a change in the 1 to 100 cap on the ratio. Just sort of summarize some of the prior meetings. So the purpose of the syringe service program is harm reduction. That's the primary purpose, is to reduce the transmission of communicable diseases. We heard from a number of experts and some high-level points that substance abuse disorder is a disease, that SSPs result in a reduction in risk behaviors, and that includes disease prevention, that the programs do not increase the frequency of substance abuse, nor do they increase needle waste, and often they will reduce needle waste. We heard one of the major benefits of these programs is the ability to interact with people suffering from substance abuse disorder, to engage them with appropriate secondary services and treatment programs. We had a public forum. A number of people came from the public. To sort of summarize, I think the points that they made is that they don't think the SSP should be authorized or that it should be prohibited, meaning it should be prohibited, that it enables providing needles as an enablement of substance abuse, that it's a crime to provide needles, that needle exchange programs don't work, that they increase crime. There was concerns about local funding being provided to fund an SSP program. The public generally that commented was in support of treatment programs. They also commented that SSPs or needle exchange programs cause HIV increases, that these programs aren't safe for the community's children, and that they allow a safe site for illegal intravenous drug use. In providing this summary, I'm not commenting on any of these items, whether there's a factual basis or not. We could probably get into some discussion of that as we go through the work session. So at a high level, the purpose of the work session will start, we may complete it tonight, we might not, because it will take time to draft an ordinance, and we're awaiting the CDC's rulemaking. We're not under any significant time pressure to move this. Um, our, our moratorium will run out here shortly, but we'll have an item in front of the council next meeting to extend the moratorium to allow time to finish this work. So really the purpose of our work session is to discuss whether a regulatory ordinance is needed, and if so, the policy areas that would be included in the ordinance. As we work through this, staff will be assisting us here, taking notes. Once we have some sense from the council as to the policy areas to be included, a proposed ordinance will be drafted, and then we'll go through the normal adoption process. I guess the last thing I would say before we start into the substance discussion is that as we're thinking about these policy areas, it would be beneficial if you think of these various questions in three different lights. One is bricks and mortar. If you'll recall that an SSP provider has to have a fixed, brick and mortar site. They don't necessarily have to do SSP services, but they have to have one in the community. But they may, often they do needle exchange in these sites. Fixed outreach, which you'll recall from the prior meetings, is identified locations not at the provider's brick and mortar site where they go on some regular schedule. So just to make up a use case, you could have an SSP that says, I'm going to go to the 121 Mill Street every other Wednesday and provide services. And then the statutory change for the forthcoming rules is mobile, which is a little different than fixed outreach because it doesn't have the requirements for pre-designating the site. So as we think about various policy areas, if counselors have thoughts that regulation should be different for those different types of methods of engaging in needle exchange, SSP services, we should think about it that way. With that, I have a series of questions, I think, to help guide the discussion of the council. We'll walk through these, talk about some various policy issues. I'll stop here for a moment to see if councilors have any questions about the introductory remarks or what we're going to try to accomplish here in the process. No? Okay, so I think that the first question for the council to deal with is whether the city should prohibit the operation of a syringe service program. So I raise this for the council's consideration because, as we heard during some of the public comment, there is some, at least from the people who came to the meeting and provided public comment, some sentiment that this type of activity shouldn't be allowed in the city. I would preface this by reminding people of the first work session we had and comments from legal counsel about this, right? Because SSPs are not only authorized by state statute, there is funding provided by the legislature through the CDC to help operate these programs. So we can talk about this issue of prohibition, but I think that that should be framed with an understanding that if the sentiment of the council is that we should prohibit this, then I think we should immediately move into this discussion about what the ramifications of that are, both from a timing perspective and expense perspective related to potential litigation. So I guess that's the first question on the table for the council is thoughts about whether despite the legislative authorization for the program prohibiting SSP activity in the city. Councilor Randall.
Are there any conditions to the funding that we would get from the state?
So SSPs and Ann Seitz is here from CDC if we have any particular questions about the intricacy of this, but at a high level, my understanding is the city doesn't directly get this funding. That SSPs that are certified in the state program get certain state funds to operate their program. And so I don't think there's a direct tie to the funding, right? If they're not operating, they don't get the funding, and if they were operating here and they were certified by the state, they would have access to the funding. Council Platt.
I have also a funding question. It may require some CDC expertise, but when it comes to the funding of the SSPs, what is that a function of? Is that just a function of being recognized as a provider, or is it a function of providing syringes, or is it a function of head counts that come through? Because what I'm trying to, I know that you'll ask lots of questions and I'll have many answers to speak. I'm not in favor of banning these outright. I do believe there is some guidance and guardrails that we need to put up, but I'm curious, most of what we're going to talk about is going to revolve around the debate of syringes and syringe use. But we've heard that there are many other very positive and beneficial things that these providers are providing locally. So I'm trying to understand the relationship between the thing we're about to debate, which is syringes, and the actual funding for these providers.
Yeah, so Ms. Seitz, I think, can help us with that. I think the big picture answer is it helps offset program costs.
Good evening. I'm Ann Seitz with Maine CDC. I'm the director of the Infectious Disease Prevention Program. Nice to see you all. There is a complement of funding that is offered to SSPs that are certified. Some are state dollars and others are federal dollars that come through both Maine CDC as well as the Office of Behavioral Health through the Department of Health and Human Services. The different funding funds different things. So, for example, the funding that we receive, Maine CDC receives through a cooperative agreement with US CDC, we're able to fund HIV and hepatitis testing services. And we also support navigation of persons who are testing that then need treatment. The funds that are mentioned within the SSP law are more generally for SSP operations. So SSPs are able to leverage these funds to be able to support their ongoing operations. Some dollars will be used to purchase syringes and other supplies that are handed out as part of their service. Other dollars are used to support other activities. So SSPs typically design their budget based on what's possible within the funding they receive. And they can also go out and receive other funding that's not conditional to being certified.
Council Platt, any follow-up on that?
No, thank you. That's thorough. I guess I'm just trying to understand that the thing that we're about to debate, how does that reflect the budgetary considerations for these organizations? I know there's no silver bullet explanation for that, so I understand.
Just a simple question, but I like to start there. Just confirming, if we say, nope, not here, the litigation part is that we are then in violation of the state ordinance?
No. So if people recall the discussion that Mr. Stockford had on this issue, typically state law preempts a local ordinance. And I think it's quite clear relative to home rule that if the state prohibits some activity, a local entity can then not allow it. There is I think a general operating practice that if the legislature specifically authorizes some activity, that municipalities do not then directly prohibit that activity, although, to be clear, Mr. Stockford's advice to the council was that there was not clear case law on this issue. So I think that the potential risk to the city is that if we were to prohibit this, we could potentially get into litigation. It really wouldn't be about the syringe service programs. It would be more of an arcane legal point about whether, under home rule authority, the municipality has the ability to prohibit something authorized by the legislature. And so that would be my explanation. My own thoughts on this are that that could be a very expensive, time-consuming process that's, if some other municipality wants to take on that fight, then we should see what the outcome was, but the litigation wouldn't be directly around SSPs. It would be about the balance of home rule authority against the inherent authority of the legislature. Other thoughts or questions on this point from the council? Council Cowan.
Thank you, Mr. Mayor. To your original question about whether or not I feel we should prohibit the programs, I don't, for a couple of reasons. The purpose of it is really about that interaction, the education, federal dollars for testing, the extra benefits are extra benefits, but my recollection, and Ms. Sykes, I think it was you that presented it, and you can correct me if I'm wrong, but my recollection was that there has been studies and evidence that in addition to reducing education, disease prevention, reduction of HIV and spread of hepatitis C, is that there was an increase of those who were involved with, who were enrolled and participating, interacting with people, caregivers, and at syringe programs. There was an increased likelihood that they would end up voluntarily enrolling in treatment programs than if they were on the streets and making that decision on their own. So I look at that as an indirect benefit. It's not the primary, but I do think it's a secondary, and I wanted to point that out because that was contrary to some of the concerns of those who came before us at the last workshop at the public forum, because I think that was a misunderstanding, and I think that's important for us to make sure we're correctly thinking about that. There were, most of those who spoke said that there was no evidence of a benefit and that there was actually increased harm, and I think there is a benefit in terms of the drug treatment piece of that, as well as reducing the risk of spreading HIV and infectious diseases. So from that standpoint, I think that provides a benefit, can provide a benefit to our community. I think the work we want to do, and that we'll be starting tonight, maybe finishing tonight, is putting parameters and guardrails around how we want a program to run in the city so that we're providing the benefits to those who enroll without undue risk for the rest of the community. So,
Thank you. Any other comments? Council Butler.
I was wondering if I could hear a little bit more on maternal health and how that's managed within an SSP.
Well, whomever could answer that.
Oh, I'm not necessarily the expert. The restriction around participants to an SSP is around age. There's no restriction around gender or status relative to reproductive status. In the event a woman of childbearing age is being served through an SSP, or a woman who may have children, those services would be, the ideal is to wrap around to that client in their needs. The service is very much built on meeting people where they're at, and being able to support individuals in their care journey, whether that's through substance use treatment or accessing maternal child health services. I'm not sure if I'm getting to your question, but that is the intent.
I think a little of what I'm looking at is in terms of the referral service. If the folks who come in who may be carrying will be referred to mom's program or something similar.
Yes, so the referral network available through an SSP is usually quite advanced and in depth to actually be very specific to that individual. And I know there's representatives from our SSP located in Lewiston here. They may be able to speak to specific examples. But yes, for example, clients will say they have needs around food, shelter, like basic needs. And those will be, there will be opportunity to support those clients, whether it's through a direct referral or some other service. And then there's also that opportunity of thinking about treatment services or other services that may be relevant for that individual.
You all set? Any other thoughts or questions? Yes. Councilor Randall.
I heard that you had said, sorry, the lady who was just speaking said that there were restrictions for age. Could I just get clarification on that?
Yeah, I believe in the statute, they have to be 18 years of age or older to receive services through an SSP. Other questions from the council on this? So we've heard from several councilors in opposition to a prohibition. Before we move forward, is that the sense of the council? Is there anyone that doesn't want to take that approach? Councilor Walker?
Yes, I'm not in favor of this. I'm worried about more stuff happening in the community that this will bring forward. I think it will definitely, depending on where we put it, where it ends up, how it really works. Looking at some of the stuff that already goes on in the city, especially in the summer months, it scares people away from our playgrounds. People won't bring their kids to certain playgrounds because of the homeless people that are taking it over. We have no one that takes care of that, and I'm afraid this will happen, the same thing. They'll hang around, wait on the corners until it's their turn to get in or get out or make deals with some of their friends. This stuff doesn't do anything good for our city. If someone wants to put it across the river and they want it there, go ahead and do it, but I'm against putting it in Auburn.
Councilor Randall?
I'm the opposite. I believe that if we have it here in Auburn, then we're taking care of our citizens, and that's what we are elected to do.
Any other comments? Councilor Gary?
Thank you, Mr. Mayor. We are elected to represent all citizens of all incomes and the whole 9 yards. I'm not going to say I'm totally against this, but we have to be very careful where it's placed so that people have access to it. But like the good Councilor Walker says, right now we've got needles everywhere, and I don't know if this program is going to nip it in the bud or make it safer in our parks. I mean, I've been down to Bonnie Park last fall, and they were all over the place, and parents were afraid to bring their kids there. And then there were some all over the lawn over by Little Theater's yard. And we've had to have our public works guys go out there and try to clean it up. I mean, we've got to come up with some sort of solution that is right for everybody. And when we discuss this better and more, we've got to look at all the alternatives and all the different measures.
Yeah, thank you, Councilor Gary. We're going to get into a whole series of questions about what an ordinance that regulates this might look like in these various aspects. So I think my understanding of the sense of the council at this point is that the sense of the council is not to prohibit this, and so I'll move on. So I think the next question is, if it's not going to be prohibited, does the council feel there's a need for additional regulation, right? So state statute currently authorizes SSPs under a fairly limited set of regulation. In actuality, somebody could leave the temporary moratorium aside here. After the moratorium expires, there's nothing that would prevent an SSP for operating under the minimal set of guidelines that's in the statute and in the CDC rules. So I guess that's the next question. If it's not prohibited, is the sense of the council to work through this to talk about other additional potential regulation, Or is the sense of the council to say that we're okay, they can operate under the state statute and the state rules? Councilor Randall.
I definitely believe we need further regulations.
Councilor Geary, you're shaking her head as well.
I
Councilor
also
Platt?
support that sentiment. I think we need regulations, or at least have the debates surrounding zoning, surrounding, I think the syringe exchange number is gonna be a topic of discussion. And I also think funding and or budgetary discussions will be pertinent. So those are the three buckets that I believe I'll be speaking to.
Okay. Any other comments before we move on? So, we'll walk through a series of questions here. These aren't necessarily in any particular priority order. There are a number of things that have been identified as potential areas to discuss for regulation. The council may or may not decide to have some regulation in any of these particular areas, so we'll work through them. So I think the first question to put to the council then, if we're going to have a regulatory ordinance, is whether syringe service programs should be limited to state-certified entities. If you recall, in some of the prior workshops, it was clear that the authorizing legislation is quite broad, and individuals only have to become certified if they want to receive the benefit of the state funding. So the thought on this is that we could work from an area of total regulation, or we could start with a baseline that any SSP operating in Auburn has to be state certified, so that they've at least gone through the certification process and the requirements set forth by the state and statutes and the rules. Everybody seems to be saying yes, they think that that's a good place to start. Okay, so I have a list I'll walk through. Once we get done this list, counselors or staff is here as well. They may have some additional areas I didn't think of that you want to discuss for potential regulation, so we'll walk through this list, and if you have other areas afterwards, we'll just add them to the list and we'll work on those. So I guess the first question I have on my list is which districts, and here I'm talking about zoning district regulations, just as sort of a way to frame this. Are there specific districts that SSP should be allowed to operate in or not operate in? So as an example, if you looked at this high-level industrial districts, commercial districts, residential districts, and I guess we would frame this from, again, from bricks and mortar, fixed outreach, or mobile. And what are the councilors' thoughts on tying this to some type of use regulation? Councilor Platt? Use. In other words, when there may be other ways to frame the question, but typically, with lots of activity, even commercial activity, it's tied to the district zoning regulations regarding use, what activities can take place in particular areas.
When you turned your head and you said that, I thought you were saying youth. Like
Oh,
as
no,
kids.
sorry. Yeah, that's fine, thank you. Any thoughts by the Council Platt?
Yeah, I guess just to give you some notes to take down. I think there are two zoning considerations, or at least two that pop into my head immediately. So I think for the brick and mortar, I think we need to be looking at zoning districts that protect, I think there need to be provisions for distance from schools and churches. I think that's probably for all brick and mortar, mobile, and then whichever the one in the middle was. So I think you're looking at schools and churches. I think you need to think about setbacks. I think as far as what zones to be in, I think considering access for those who need these services, we can't just zone this out on the border of Auburn and Minot. That accomplishes nothing. So I don't know all the zones off the top of my head, exactly what the overlay is, but we're looking, near a bridge, near a walking distance, downtowns, places people can get to and services can be provided. Again, I think when it comes to mobile, I think it's easy to say, well, we want to meet people where they're at, but I do also feel strongly that we shouldn't be allowing people to deliver syringes, 200 feet from a school. We don't want people shooting up 200 feet from a school.
So we'll get to a further question
Yeah.
about
Great.
various types of facilities, but
So zones and setbacks, those are the two things I think
so
we
from a
consider.
zoning perspective, we might think of this in terms of like industrial zone, commercial zone, residential zones, right? There's many residential zones, but they're all residential. And I think that might be the first cut of where things would be allowed to be located, if people have thoughts on that. Councilor Cowan?
Thanks. I think I would want to pose that we keep the programs out of residential zoning. I'd want to look at what that would prevent, if that would mean that we're preventing from certain places. But I think I agree with Councilor Platt's sentiment. We want to have this available more where there are likely services or other things, bus routes that they can get to. But I think keeping it out of residential is going to keep, to me, I would want to explore how we can do that and what that would, pros and cons and limits.
So the follow-up question I would pose to that is, we'll assume for a moment that we say we want to prohibit the activity in residential zones. Do you differentiate any differently between brick and mortar, fixed point, and mobile? And the reason I raise that is, you may have situations with mobile that you have encampment areas, and they want to take their van and go to the encampment areas, and some of these, and having been around to most of these in the city, they're in all kinds of different zones, including residential zones. Whereas, brick and mortar is a fixed site that people are going to, so we might want to think about some of these a little differently.
Yeah, great question. I was thinking of the brick and mortar, the primary location as well as fixed sites. I think we would. I hesitate on the mobile for the reason you just raised, Mr. Mayor, but also because we don't know exactly what what the regulations are going to be around them. So for me, it's hard to respond to that exactly yet because we don't know exactly where they're coming. We may need further delineation at a later time.
Yeah, and we'll get more follow-up as CDC works through the rule development on that. From a statutory perspective, it's quite broad, right? It's mobile, and you can go to where the people are. So, Councilor Geary?
Thank you. I'm not sure where all the rehab centers are for people to go to that are trying to change their life. I'm not sure where the counseling offices are for helping people change their life. I think if we're going to deal with exchanging needles, then they should probably be located near them so that they could have a better watch over who's getting what, why, and how. And I don't want us to go to parks or places where there's going to be average, regular citizens that bring their kids, because kids shouldn't be around where we're trying to hand over needles to somebody that wants to use them. Because what's going to say that the minute we turn around and after giving them, 5 feet away they use one. I can't have that.
So just to add some clarity around this, you can walk into any pharmacy in the city of Auburn and buy them off the shelf, 100 pack of needles for $18 or $20. You can have them sent to your house by Amazon. There's many places in the city today where you can go in and just procure needles. we just need to keep that in mind, I think. They're no longer, hypodermic apparatus is no longer, possession is no longer prohibited. You can buy it as a consumer product, you can buy it off the shelf. So any other thoughts? Councilor Cowan has suggested the bricks and mortar and fixed sites should not be in residential districts. Any other thoughts from councilors on this item? Oh, thank you. Councilor Randall.
Just to piggyback on Councilor Gary, her point, I see her point in not going with the mobiles to the parks. I think that even though they can go to CVS or get them on Amazon, I don't think that it should be city sanctioned where we're handing them out in a park. I have to agree with that.
Councilor Duvall.
I'm thinking spatially, I just wonder what the overlap is between, where there's good access for people, as Councilor Platts was saying, and also where our residential zones are. My recollection is that a lot of these zones downtown where there's form-based code are residential, and then the commercial districts are not necessarily here. So I just don't understand how those things actually would interact, and I would like to know information about that.
Yeah, so it raises an interesting issue because since the first regular session of the legislature, there's no such thing in the state of Maine as a straight commercial district anymore. The state has outlawed the prohibition of residential structures in a commercial zone. So we have, we have residential districts that have pretty significant limitations on commercial activities, but some of the zones, like the zone we're in here, is a form-based code. It allows both. So I think that perhaps we should think of this as where, commercial activity is allowed, which is in, general business, T52. Some of these places allow significant commercial activity, even though they also have residential regulations, and even in the commercial zone, it adopts multifamily suburban as its regulation for residential housing in general business. Other thoughts? So I think the next questions might revolve around when these can be operated, hours of operation, days of the week, hours of the day. Is there any thought about whether there should be regulation around the time frames in which an SSP can operate? Council Platt.
I guess short of having an opinion, I guess I would ask, with regard to when they're open, is there any, I guess from the service provider's perspective, is there any benefit in truncating hours so that you're forcing people to come in at a certain time of the, if you're seeing people in the morning, are there better outcomes than if you see them at 4 p.m.? But if you see them if you don't see them in the afternoon, are they maybe subjected to a negative situation where they don't have what they need? I don't know, but I'd be curious if there's any logic behind having full hours versus less than full hours. Is it the desire of an SSP to be open 9 to 5, 5 days a week? I have no idea.
So there's staff here from Spurwink who might be able to help us with this. I believe they're open Monday through Friday business hours, but I think it's also a broader question, especially as mobile comes into play.
Hello, I'm Ernestine Peralt, and I'm the Community Outreach Program Supervisor at Spurwink, and one of the programs that I oversee is the SSP, located at 1155 Lisbon Street. We've evolved over the last 3 years. We were 14 hours when we first opened, and then And most of that, what drives a lot of this is funding and the ability to have staff, obviously capacity to operate the clinic. I would say, I've been with the operation since it began with the 14 hours, and now, and that was, that clearly did not meet the need. We utilized myself outside of the 14 hours that a person was there, a staff person was there for the clinic, then all the other hours that someone would show up at the 1155 building, we would still accommodate them. So that it relied on me as a supervisor to go and tend to them. We never really turned anybody away. If the building is open, which it's generally open for, I think, 8 to 5, Monday through Friday, then we've, in the past, before we were full-time clinic, then we accommodated anybody that showed up between those hours when the building was open. And we did that just merely because there really is no, I don't think there's any perfect time frame that you're serving people. It really is when they can, where you are located, we're pretty far out. So it takes some time, and as well as on a bus route to try to get there. So we didn't turn people away if they showed up at times that we just didn't have a staff person there. So we accommodated. We flash forward to about a year and a half ago, we were able to get more funding, and we have 3 full-time staff now, not including myself, that operates. And so we make ourselves available 40 hours for the clinic, Monday through Friday, 9 to 5. Predominantly what, again, drives that is the opportunity that the building is open during those hours. So we have the luxury in our building. I have, 15-member staff that are all community outreach based. So it allows for people that are coming into the exchange to also have capacity to interact with the rest of my community outreach team and gain support and services, recovery coaching, et cetera, referrals. That is a luxury. I'll admit that. That is a luxury of being, owned by a behavioral health company that just within our building, we have 20 plus services there. So there's a lot right there available to people when they come into our exchange, that if they say, today's the day, you've been talking to me for a few weeks about, going to counseling or getting a case manager, then we can very quickly, obviously, because of access and ability, and because we have those services there at that building, we can make those connections promptly. So that's what works for us.
Could I just
Go ahead.
react to that real quick? Thank you for that response. I think with that said, to answer the original question on times, I think my opinion would be, what we were trying to create is an environment where our best SSPs have everything they need, but we're still creating guidelines that maybe allow the not best providers to not be able to get away with certain things that the public is reacting to. So what I'm hearing you say is that a 40-hour week does allow us to have access to those in need. I think I would support a brick and mortar, normal work week, 40 hours, 9 to 5, 5 days a week. And then maybe mobily, there is no time limit. If somebody has a need at their home at midnight and an SSP wants to provide that service, perhaps that's allowed. That would be up to the SSP and obviously their funding and their budgets. Again, I'm not so strongly opinionated on this, but just to give you some answer from, yeah.
Yeah, so to follow up on that, similar to my thoughts, through options or through the people that are working at the brick and mortar, if you had feedback about whether the brick and mortar hours are sufficient, and then especially for options folks, are you doing fixed sites? And if so, are those during the same hours? And as mobile becomes available, what do the outreach people see as the need? Is it beyond those hours, or could they be contained within a regular work week schedule?
I think we do our best to accommodate folks within that time frame. Is there a greater need perhaps on a weekend? Yes. And we've not ventured there, because of funding and capacity, staffing. But there is, people coming in on a Friday. Friday is clearly our busiest day because people are very well of the understanding that they're not going to be able to have access to any of these kinds of services for the weekend. So we are, we're still seeing people at 5 o'clock, provided that the door is unlocked at the front, then we're still seeing people and we'll see them until the last person is, in the door. So, so I think we do our best to meet the need. Is there a greater need? I would say certainly for weekends, there would be. And currently we are only operating, obviously, at 1155 Lisbon Street out of our brick and mortar. My team does a lot of outreach, but there's no exchange sort of service or situation that's happening in those outreaches.
So thinking about the outreach team, Spurwink might not opt to do this, but if an SSP was providing mobile, what types of hours are the outreach teams interacting with folks out in the community? Are they all working just these regular business hours, or do they have some type of different schedule?
It depends. I have 9 different teams, so 9 different programs that are serving the, Androscoggin County, quite frankly, not just Lewiston and Auburn. And so it's different capacities. Liaisons they have the great flexibility. So there are some that are opting to work a weekend, opting to work into the evening, the very wee hours of the morning. And it really is what they feel as though as a liaison that they see the need in a community. If they find that they can see a lot more people doing outreach at 6 a.m. in a particular area, that's where they're going to go. If they find that it's on a Saturday midday at the drop-in center and they know there's going to be 100 plus people there, that's where they'll be. So they have a lot more range and flexibility with their hours.
Councilor Gary?
Thank you, Mr. Mayor. Now that you mentioned that it's countywide, could we be provided the numbers of how many clients you have per municipality in the counties that you represent?
I wouldn't have those numbers right off the top of my head, but those are certainly, outreach numbers that we could get for you all.
Well, I don't expect it tonight. I mean, you've been kindly here to answer our questions, but could you provide us at another time for these numbers?
Yes.
Thank you.
You're welcome.
And I think a companion question with that would be, what are the towns of residence of the people that are getting SSP services at your location on Lisbon Street, right? Because you're located in Lewiston,
Mm-hmm.
but as long as someone registers, they can be from any. I mean, they're probably not going to be from Bangor and drive down here, but any of the people from surrounding towns could come in and do their needle exchange, correct?
They could, yes. It is, we have a whole host of questions that we try to get people to answer. It's not a requirement that they, because it is a confidential, anonymous level of service. So they could come in and say that they're Daffy Duck and provide no other information about themselves or where they're located, where they're coming from. Most people are pretty forthright in terms of saying where they're coming from. Particularly, it's in the context of that it's challenging oftentimes to get to where we are. They'll say, I had to take four different buses to get here, or I had to take, an Uber or a taxi cab and it cost me $57. Well, they're probably not coming quite locally if it's costing them that much money. Or there'll be 6 people in a car that, came from someplace and they all decided, that they were going to support each other to come to the clinic that day because the transportation was a hardship. So we certainly know just probably by having conversations with people that they're coming from more than just Lewiston, to the Lewiston clinic, yes.
Other questions or comments from the council? So we'll move on, I think. to a question regarding number of SSPs. I think this has been a conversation around the state in various areas. I think, and Ms. Seitz might know the answer to this, but I don't believe there's any place in Maine that's being served by more than 2. And some places are only served, as Lewiston Auburn area is, by 1 SSP. Is that correct? Yeah. So, but it's a question to raise. I know it's come up in other discussions in other municipalities, whether there should be a cap on the number of SSPs that are allowed to be allowed to operate within the city. Any thoughts on that? Some of this might be self-regulating because there's only so much money and there's only so many providers, but especially if they're certified. Any thoughts from the council? Council Platt?
I guess I understand the thought to cap it is because we don't want to be providing SSP services for 80% of the state of Maine with, 10 providers. I get that. But as you said, it's state funded. The money's not growing on trees. I just can't envision a reality where there's 6 providers who come to one municipality and all of a sudden they're serving, 2 counties, just because we haven't seen the precedent for it. But
Other thoughts? Council Walker?
I think having a mobile, we should probably be looking at 1 at this point, if that mobile's gonna actually come and be worked here.
Okay. That seems fairly limiting, because not all providers may provide the same service. I mean, I would suggest if you want to limit it, that you at least provide 2, so that they may not all work the same hours, they may not all provide the same services, they might not all be trying to outreach to the same communities, so.
my only concern with 1 is what if the first one was a bad player and they got the authorization, but maybe we ended up having issues with them. I wonder what kind of teeth we'd have to make changes. I don't know.
Council Cowell?
I think my sense, I agree with Councilor Plass that there does not seem to be a precedent yet set that, too many organizations, programs are coming into one area. So I guess I would err on the side of let's not make it too restrictive, knowing that an ordinance can always be edited and revised if that became an issue. But again, because we don't really know how the mobile programming may work or not work, we might have to make some changes anyway. So I would leave that alone myself.
Would we have the ability to, through issue of order, cap it? All we'd have to do is notify the public, have a certain amount of public notice, a public hearing, and then we could enact an ordinance in a year, right? To say we're capping this at 2, we're capping this at 3. It doesn't have to be at the creation of the ordinance. Is that correct?
Correct. If you enacted some type of an SSP ordinance and you wanted to amend it, it would just be the typical adoption process, with 2 readings. Practically, it probably takes about 6 weeks from the time, as quickly as you could do it, unless you want to call it, you could always have it's an emergency, a special meeting. But in the normal flow of things, you could probably change the cap in about a 6-week period. Councilor Gary?
Thank you. The thing of it is, though, if we want to have a cap and we don't set a number, people may apply that are certified, and we'll have 5 or 7 or 10 and there's no way to pull those back if we decide that we only want 2. We've already
Right.
opened the door.
Yeah, that's a valid observation.
It's actually got me thinking a little bit, almost the opposite where I started. I don't necessarily agree of a cap of 1, but I I could certainly understand that you could cap it at 2 or 3 to start. You could analyze the results of your approved applicants, and if the council had an appetite to increase that cap, they absolutely could. But setting it now avoids the complication of 10 providers all applying at once and kind of overloading the application system. So
I too agree. Great point, Councilor Gary, that I'd propose we consider a cap of 3 and see what that would be. Maybe come back.
Council Butler.
Is that also something that we could roll out over time? So rather than 3 all at once, lay them out over a period of time?
Sure. You can basically structure it any way the council would like to structure it. It raised the question about what the timing of all this is. To the earlier points, you could probably increase the cap as quickly as someone new could become certified anyway. So, you might want to start it at 2 because 1 seems too limiting. It doesn't seem like across the state there's great pressure to have 3 or 4 or 5 any place, but if the situation arose, then the council could consider increasing it if some need presented itself.
I
Council
support a
Platt?
cap of 2. Yeah, I support a cap of 2.
I do too.
With understanding, on the record that I'm open to discussion in the future if that cap needs to go up. This is not a move to restrict, it's just a move to be smart about how we roll this out.
Councilor Duval?
Yeah, I think choosing 2 is as good as choosing any other number. I agree that 1 is maybe a little low, but going above that, I would want to know why we would want a higher cap than what any other place in the state has. If we're just choosing numbers, like that's as good a reason as any, particularly given that we can expand that as needed.
Yeah, so just to be clear, and if I misspeak, Ms. Seitz will help me out here. I don't believe in most of these places in the state there is a regulatory cap. I think that the natural evolution of the capacity of providers and their ability to get certified and go into these various markets is what has driven this, and they've ended up with 1 or 2. There has been some discussion in various municipalities about setting a cap, but I don't think what's driven this across the state is a regulatory cap at this point. Is that correct? Yep, thank you. Councilor Randall?
So if we're considering capping it at 2 right now, is that 2 brick and mortars? Is that a brick and mortar and a fixed? Is that what I would support is maybe 1 or 2 fixed and then 1 mobile that has restricted hours, like after hours, for when the brick and mortar buildings are closed.
Right.
Is
So-
that what we're discussing? Is that?
No, not exactly. I think I can help with this, and again, Ms. Seitz will straighten me out here if I misspeak. My understanding of the way this works is in order to become certified, you have to have a brick and mortar presence in the community. You have to have an office there. You may or may not choose to do SSPs at your office, but once the entity is certified in that community, then they can provide the range of services, brick and mortar, fixed site, mobile, in whatever combination they are using to address the need. But they're not certified by type.
Just to add on to that, Mr. Mayor, is that at the time of certification, they must list out where they're planning to operate and what type of operation site. And then if there's a change in their operation plan, they need to submit that to the state as well. That's according to our current rule.
Does that, Councilor Randall, does that answer the question for you? Other thoughts? Okay, so let's move on to a topic that came up a little earlier. It's really about distance from variety of facilities. It could be other SSPs. It could be, I think schools were mentioned. What I guess I'd be interested in the thoughts the council has about a separation distance from certain types of activities or facilities and the basis for that separation. If anyone wants to venture in here, Council
Yeah,
Platt.
sure, why not? I love talking. I think that, as I think about this issue in setback, I look at precedent. What other things do we have setbacks for in the city? The one that comes to mind immediately is cannabis. We talk about it all the time, and we have cannabis setbacks. So I feel that and we do that because we don't want folks consuming cannabis, or at least being party to the purchase of cannabis next to, I don't remember the distance, but there's setbacks from schools and churches. Now, you can make an argument that buying cannabis is different than receiving a syringe. However, I still feel like it's now a state-sponsored service. We're giving someone a syringe to engage in what we can only presume is the use of drugs. So I would say those setbacks, at the very least, need to be equal. If for some reason we determine that that's illegal or we can't do that, then great, that's a discussion we need to have. But my gut tells me that these setbacks should be equal for parity's sake. But
So the other thing I want you to think about in this is, if you were to set a setback equivalent to what we do for cannabis, you'd probably eliminate almost all of the whole downtown area this was a comment that we provided back to the CDC on their rules. They were proposing, in the proposed rule, I don't remember, it was 1,000 feet or 2,000 feet or something. We mapped that out, and pretty much you can't do it in Auburn. And the question I would raise is, you're doing we'd have pharmacies that you'd be telling you can't do this business, you can't sell this. So someone who's diabetic couldn't buy their needles anymore. Right, because there's no difference between a syringe that's being sold in a pharmacy or given out at a medical facility.
I'm sorry, I should clarify. I guess I'm going back to a comment I made in one of the original questions. I'm thinking about mobile. I think brick and mortar and fixed outreach, I'm pretty satisfied with just restricting those by zone. Obviously, if we determine there needs to be a setback, okay. I'm thinking more our delivery services. I apologize. Not our delivery services.
That's
the delivery
an important
services
point.
of an SSP. I'm sorry, my mind was still stuck on that. I said that 10 minutes ago, and that's what I was thinking about when I just responded.
So if I'm following your thought here, that brick and mortar and fixed site, long as they were in an appropriate zone, those sites would be okay. Mobile operations would be separated from wherever these various, whatever the various categories of thing people decide to limit.
I would think so. I do think there possibly still needs to be some setback. I wouldn't want to have an exchange 15 feet from a school. If that blacks out the whole city and we can't have exchange providers, okay. But I still think there needs to be some setback. I guess the other thing I struggle with a little bit is to say that if we enforce the same setback with cannabis on service providers, they wouldn't be able to operate. Well, it's not necessarily an argument to allow them to operate. I mean, I get that, but at the same time, we do it to cannabis. So we're already doing it to one industry. It's hard for me to hold a different standard to another.
Mr. Manager?
I think just to address the point that you said regarding parity, we have other restrictions, right, for other services. So it's 750 feet for marijuana from a school, whether that be a public or private, whatever it's determined to be licensed or determined as a definition of a school. We do have addiction treatment facilities. That's 2,000 feet from a school, a church, a playground, or a park. So we do have, so that you know what other language we might have. Those are really the two that probably stand out. And we've done this in the past. We've taken, actually, we already have the layers of the maps. We can actually show you what does a 500-foot buffer look like? What does it restrict? And then what does, 1,000 foot? What does that look like around a school? So we can do that and provide that. And And I think that the language, you know, I think this has been good work. I think there's a few other things I would mention, just so that we have it kind of come in alignment with some of the other ordinances we have, but, you know, I think that it's an exchange. The difference is that this is a needle exchange site. So it wouldn't be the same restriction as like for a pharmacy, but it's an exchange site. So it's gonna meet that definition of the state statute, and they're gonna be licensed under that. So, so those, I think, we see marijuana businesses with the buffers now throughout the city. And so, but I just think we have to be careful, as the mayor said, does it just restrict an entire area that makes it, why bother having it? You've basically created it so you cannot have any type of exchange service. When your intent was to go ahead and provide that, well, let's look at the buffers and see what that might do.
And that's fair. Like I said earlier, we don't want to put this out on the border of Maine and Auburn. I understand that, but I do also just want to acknowledge, you know, publicly on the record that the majority of negative feedback we have about this is, whether it's true or not, people have their own anecdotal experience, but it's needle prevalence around children. And so I just want to make sure we give the right amount of time to the discussion of setback, especially from schools. Churches, yes, but definitely schools, whether it's 10 feet or 100 feet or 1,000 feet.
Councilor Randall?
I would also think that we would add childcare centers in addition to schools, or is it, that's not blanketed, right, under school?
Well, I'm sorry, just to be clear, the marijuana licenses is just for schools, private schools.
Right.
And then the addiction treatment centers includes childcare centers, daycares. So that's how we currently have language for those two licenses.
Any other thoughts on types of facilities and separation? Council Collins?
Nothing different, just to confirm and I guess support. I agree with Councilor Platts. I'm more concerned about looking at what that those buffer zones might be around schools as opposed to the churches, because I think that's where the predominant of the children are, and that's where I think the greatest concern will be, or what we've already heard from residents. So.
Councilor Duval?
Yeah, I think I agree generally, but I really am interested in looking at some of the different buffer ranges around various different
So we'll
types of facilities.
We'll prepare for future workshops, some use cases, so the council can see what that would look like from a map perspective. I think that's the easiest way to understand it, is to see it on a map.
I guess just while we're thinking about maps, getting zones in those as well. I think like our residential, commercial, all those zones labeled on those maps as well would be really useful.
Sure. We only have about another 5 minutes. We've gotten about halfway through the list, so we'll continue on at the next meeting, but I guess I'd take the last 5 minutes. Are there particular policy areas that counselors are thinking of that you have in your mind now that you want to make sure we discuss, and then I can see if it's on the list, and if it's not, I'll add it on here for the next meeting. So are there any particular policy areas that counselors want to make sure we cover in the discussion?
Mr. Mayor, I've got one. I'm sure the one that, I think the needle exchange ratio, I'm sure that's on your
that's
list.
on there.
I can't imagine it's not. Something that I've thought about, and again, I'm sure it'll elicit a wide range of opinions, but it is fees, application fees. I don't know if that's something we've ever considered. Again, I think about the things that I see and that I personally know, and that's the cannabis industry. There are fees to offset the costs of the municipal costs of inspection and permitting and licensing. I'm not saying I'm dead set on this, but I would like to have a discussion with the council about whether an application fee is appropriate, or a license fee if your application is approved, to help offset possible costs for public works, for needle cleanup. Maybe there are creative ways to do this. I don't know, but I'd love to have that discussion.
Yeah, so I think as we work through this, then we can talk about what what the scope of the ordinance might be and whether fees are appropriate or not. And in part, some of this is going to depend on how much the municipality piggybacks on what they're doing at the state level, right? So as an example, one of the things I have on the list to talk about is reporting. Well, if all you do is have them report the same information, which is pretty extensive that they're providing to the state, there's probably not a lot of anything special you need to do. If we create, a long list of separate reporting that we then have to enforce, then there might be more cost in that. So I think at the end of the discussion, once we get an idea of the scope, we can talk about this. I think I have some items on here about waste remediation and such, but I think we're going to need to talk about that at length, because I think that there's a lot of assumptions about this huge amount of needle waste that actually doesn't exist. And I'm happy to go over, again, what the manager presented, and I'm happy to talk to the council about my activities since August many times, going to look for this to validate, these anecdotal stories we hear in the city, because I think it's important for us to understand exactly what we are seeing and not sort of basing this on things we hear that may or may not be correct from other communities. We have another item we need to cover. If counselors think of other things you want to have on the list, just let me know before the next meeting. We'll put them on the list. We'll continue this discussion at the next meeting and sort of work through some more policy issues about including things in the ordinance. So with that, we'll move on. We have an update on 7 Chestnut Street. Ms. Boss and Mr. Cousins.
Thank you, Mr. Mayor and City Council. Eric Cousins, Public Services Director. I wanted to give you a quick background on the property, 7 Chestnut Street, the history there, and Katie Boss, our grants and special projects manager, will give you an update on the actual grant application we're pursuing to try to clean up the site. 7 Chestnut Street, if you're familiar with the PAL Center location, it's across Chestnut Street from the PAL Center. A map here with the crosshatch area is showing the publicly owned portions of the park. The PAL Center is right at the center of this map. 7 Chestnut Street is located here. It's a vacant site now. It's the site of an apartment building that was subject to some pretty significant DEP enforcement efforts for contamination that was found under the apartment building that was left there from a dry cleaning operation. They've also discovered some petroleum products that aren't directly tied to the dry cleaning operation that was there, but still need remediation. That property owner, during the DEP enforcement, I think had realized that there was no profitable future for that building, and they really started to let the building go. The police department, emergency responses had a lot of calls there. Code enforcement had a lot of problems there as the building just sort of deteriorated over time. So there were a number of reasons for the city to be interested in acquiring this building, make those problems go away, as well as try to facilitate the cleanup and working with DEP. That enforcement effort kind of positioned the building where the owner was willing to sell it to get away from the liability. The city's able to access brownfield funds that a private company operating an apartment building can't access. So last year, we acquired the property essentially for $1, committed to the DEP Voluntary Response Action Program, or VRAP, that offers the city some protection long-term from liability from any environmental issues on the site, but it did commit the city to pursuing a cleanup at the site and to pursue the resources through brownfields or other sources to complete that cleanup. Maine DEP has allocated some funding towards this project. They paid for an analysis, and we also have the ability to apply for funding through AVCOG, but the federal program that Katie will talk about is a larger award amount and not only allows us to do a more extensive cleanup, but also helps with site redevelopment costs. So, we're hoping to give you an update on that tonight, hear any comments from the public, and submit an application later this month.
Yeah, so what we're finding is that the cost to remediate and redevelop this site is pretty high, so we're seeking EPA funding. The application is due January 28th, and we believe that we have a really competitive application because of the type of contamination, the location being so close to the PAL Center, and we've already had federal investment in the PAL Center, which made the new building possible. So we're very hopeful, and we're working on the application now, and part of the application process is holding a public meeting, which is why we're here tonight. And the goal of us being here is to make sure that the community is aware of our intent to apply for this for this grant program for the EPA funding, to share the draft application and the analysis of brownfield cleanup alternatives, which you saw in the packet. And then the third thing is to ensure that there's an opportunity for public feedback. And that doesn't end this evening. We also are going to be making a draft application and the ABCA available physically in the over in my office, so anybody in the public can come by, take a look, and provide feedback that way as well. You'll see that there's a couple of different schematics that we provided in the City Council packet. This is a description or a quick drawing of what we envision the site being redeveloped as, including the playground and the parking site. The ABCA that was included provides a pretty extensive analysis of the different cleanup options that are available. We've been working with an engineer and with Maine DEP to look at our options. We're still waiting on the fourth and final option, so we still are not yet certain of which pathway that we plan to pursue, which is why you'll notice that the draft application was extraordinarily drafty. And part of that is we're awaiting more information, but also we need to get these materials to you within a week before the meeting. So we're moving along very well, but there are a lot of gaps that we acknowledge as part of the draft application that was provided. Eric's got up a picture of some drawings of a potential future playground as well. There were a couple of images that you saw in the packet, and then we also provided the notice that we gave about the meeting this evening that we printed in the Sun Journal. So let's see, what else do we want to provide? We're asking that the public provide feedback tonight if they're here to be a part of this conversation, or if they have feedback that they want to provide by email, to do that by January 15th, since this application deadline is coming up pretty quickly on the 28th. And the last thing that we wanted to share is that if we're not successful in receiving the EPA brownfield funding, as Eric mentioned, we are continuing to pursue other grant funds to make sure that we have this project and this contamination taken care of, because this is a really exciting vision for Auburn. It beautifully complements the completed PAL Center, so we're very committed to making sure it happens. Any questions that I can answer?
Any questions or comments from the council? Councilor Duval.
Yeah, just what is the fourth remediation possibility that you're waiting on? Do you know, or?
Yeah, so we have a little bit of information on it. We're expecting it hopefully this week to have more feedback about it, and also whether or not it's the preferred alternative. But it reduces the amount of soil that's removed to the site, from the site, and it uses a liquid mix that they inject into the soil that actually increases the bacterial digestion of the contaminants that are in the site. So it speeds up a natural process that would happen anyways, but it reduces the cost and makes it happen faster. And that bacteria, because it proliferates with this injection, digests the chemicals and breaks them down faster.
Yeah. Any other? Council Walker.
Thank you. This is going to be a great project, especially if you're able to get the grant money and whatever else is needed, because this will help to bring a lot more of our neighborhood kids to the upper level, not just to the basketball courts. Thank you.
Yeah, absolutely agree. And I want to mention too that the application we're intending to seek is for $4 million to give you the scope of the project. It's not just the remediation. We really want to try to use these funds to redevelop the site and, as Councilor Walker mentioned, make this vision come to fruition.
Councilor Geary.
Thank you, Mr. Mayor. Thank you for all your hard work for this grant proposal and all this funding because it's going to bring up the neighborhood and the quality of lives for all those individuals, no matter their income in that area, and they need that shot in the arm to let them know that they're just as important as any other resident or neighborhood in our city. So thank you very much.
Other questions or comments from the council? Is there any member of the public that's here tonight to comment on this particular item? If you are, please approach the podium and provide your name and address. Not seeing any, I'd remind the public that they can contact Ms. Boss here at City Hall, either come in or by phone or email, and provide comments during the period before the application's due at the end of the month. Anything further from the council on this item? Thank you very much. We appreciate the presentation, and the council will be in recess till 7 p.m.
Thank you.
City Councilor at Large.
Good evening, thank you for coming. I'm Rachel Randall, City Councilor, Ward 1.
Good evening, Tim Cowan, City Councilor for Ward 2.
Good evening, Matthew Duval, City Council, Ward 3.
Good evening, Jeff Harmon, Mayor.
Good evening, Kelly Butler, City Councilor for Ward 4.
Good evening, Leroy Walker, City Council, Ward 5.
Good evening, Adam Platt, City Councilor at Large.
And Phil Kroll, City Manager.
Thank you. The first item on the agenda tonight is the consent agenda. There are a number of items on the consent agenda. Recommendations from the mayor for appointment of Councilor Butler and Patricia Medore to the 911 committee, and for City Manager Kroll and Assistant City Manager Dute to the Androscoggin Valley Council of Governments Executive Committee, and Councilor Randall and Councilor Cowan to the Androscoggin Valley Council of Governments General Assembly. Nominations from the Appointment Committee to the Planning Board, Ed Barra, Bilal Hussein, and Andrea Westby. Nominations by the Appointment Committee to the Parks and Recreation Advisory Board, Claire Murray and Marissa Ballou. And at a request from the clerk, setting the opening of the polls for 2026 at 7 a.m. And the final item is an asset forfeiture from the Maine State Criminal Courts to the Auburn Police Department. Is there a motion?
Motion to accept.
Moved by
Second.
Council Walker. Is there a second?
Second.
Seconded by Councilor Butler. Vote will be by show of hands. All those in favor? Opposed? 7 having voted in the affirmative and none in the negative, the motion is adopted. The next item is the adoption of the minutes of the December 15, 2025 regular City Council meeting. Are there any errors or corrections? Not seeing any, is there a motion?
Motion to accept.
Moved by
Seconded.
Councilor Walker, seconded by Councilor Platt. Vote will be by show of hands. All those in favor? 7 having voted in the affirmative and none in the negative, the motion is adopted. I know communications, presentations, or recognitions on the agenda tonight, so we'll move on to the first open session of the evening. Members of the public that would like to address the council about any items not on tonight's agenda may do so by approaching the podium and provide your name and address. But given the large number of people in the audience, please limit your comments to 3 minutes. So if anyone would like to address the council, please approach the podium.
Ladies and gentlemen, my name is Juliet Saintman. I live at 64 Washington Street, Trailer Park Road. It is a privately owned park, but nothing can be done. All he wants is money, money. A few years ago, I was paying like $250 a month. In 3 years' time, Scott Barton has brought the rent up to $550. And I know he's gonna go up again. He does nothing. We have broken pipes, we have ruts in the road right now. The ruts aren't too bad because of the ice. But once the ice goes, you hit that rut, you're gonna go in the hole and be towed out. That's how bad it is. There's trailers that need to be demolished. There's people's trash on the porch. It is disgusting. Why do we pay our rent? He wants his rent, but he does nothing. He doesn't care. He owns places in Florida. He owns places here in Maine. It's just plain disgusting. I am ashamed to tell people where I live because I don't want them to come to my house. We never had rats in that park before last year, and now we got them all over the place. It's just, like I said, it's discouraging, it's disgusting, and we cannot afford to move. At our age, I'm 80, my husband's 83. I can't move. I'm not ready for a nursing home. I'm far from it. But if he raises that rent again, I will end up in the street. I'll be sleeping in my car. And it's not right. I have tried and tried. I know your hands on the code enforcement officers were tied. But I have gone through them for the last 4 or 5 years trying to do something. No, we can't. Our hands are tied. It's privately owned. It's this, it's that. Please, if you can, help us. Keep us off the street. Thank you.
Thank you. Come forward, sir.
Good evening. My name is Stan Hammond. I live at 435 Court Street. And the reason I'm here tonight, I want to talk about what I'm hearing about this needle exchange program. And I understand you people are considering doing something along that line. And that's just disgusting. I'm so tired of the idea of people that are supposed to be our leaders deciding that they're going to do that stuff. You're just going to kill people. You know, as far as I'm concerned, you'll be responsible for the death of people if you want to continue to do that. They need help. They don't need needles, and they don't need that crazy, crazy program. Just insanity. And I don't think you're all insane, but some of you must be. So that's my, thank you very much.
Thank you.
Quentin Chapman, 51 Eastman Lane. So this is my last plea, SSP program. I was talking to an officer a while back, not that long ago, a month ago, and he was telling me about a story. He'd gotten back on shift. He'd been off for a few days, 5 or so. And the first call he got that morning, he had to go in, a woman had OD'd. Her 9-year-old son came to wake her up at 2 a.m., and she was dead. Drug paraphernalia around her, including needles. He left, no jacket, no shoes, went to a house familiar to him. They took him in. Obviously, that person wasn't concerned enough about the mother to go check on her, because it wasn't until the next day when the sister showed up to check on her drug-abusing sister, found her dead. So I say to you, with this SSP program, as you hand out needles, is there any thought of second and third effects and how much it's going to cost, not in dollars, but in lives? How do you put that 9-year-old back together? Or his sibling that was with his father who's a drug user? So as you vote on this SSP, I want you to take that into consideration. And one more thing I'd like you to consider. I'm a state representative. In Augusta, they have these, they try to draw up attention to get money for funding. So they had a drug interdiction day. And they had, 8 different drug interdiction specialists. I don't remember who they were. Drug interdiction is something that's near and dear to me. I went and talked to each one of them. I asked all of them if they had ever heard of Ibogaine. You ever heard of Ibogaine? They claim to have a 77% success rate in curing drug addiction in 48 hours. I don't know if it's true. INH reported on it. There's been a few health organizations. Texas is currently using Ibogaine therapy. It's a 90-something% success rate in curing drug. Just saying the words curing drug addiction is mind-boggling to me that they make the claim. Curing drug addiction. 90-something% success rate, second trial use, 48 hours, curing drug addiction. Resets dopamine, regulates neural pathways. I'm not a scientist. Check it out, Ibogaine. As I went around and asked all these people if they'd ever heard of Ibogaine, only one had heard of it. And they laughed me off like it was witch doctor crackery, crackpot medicine. So if you really care about the lives of the drug addict, wouldn't you be looking underneath every rock turning every stone over to find an answer. Whether you agree with it or not, you should have heard of it. I really question the motives of a lot of people, for good reason. And I'm asking you, really consider deeply the lives of the children and the other people in this community that will be affected if you vote yes and allow an SSP in this city. Thank you.
Thank you. If there's any other member of the public that'd like to address the council, please approach the podium and provide your name and address.
Good evening, council members. My name's Diane. I live at Washington Park Road. My landlord's name is Scott Farland. I've lived there for 18 years. He bought the mobile home in 2023. He raised the rent twice that year. In 2024, he didn't raise it. The rent, but he sure made up for it. He raised the rent in 2025 by $110 a month. So it went from $440 to $550. He also started to charge us for pet rent. He charges $25 a month for each pet. I have 3 animals, so my rent is $625. So it actually went from $440 to $625. I'm sure some people may have more than 3. I own my mobile home. My animals are indoor cats, but I still have to pay $25 per month. If my animal does any damage, I'm responsible for the damage, not the landlord. My intention was to stay where I'm at, but because he's raising the rent so high, I may be homeless. We are supposed to help the homeless that we have now, but instead we're going to have more homeless people. And that is us, wait a minute, and that is, people that live in my trailer are mostly retired or disabled. They have one source of income. Most of us are either, well, I already just said, we're on a fixed income. Thank you, council members, and please help us freeze the lot rent. Thank you.
Thank you. Is there any other member of the public that'd like to address the council? Please approach the podium.
Evan Sear, 122 Granite Street. I'm here just to ask the council to consider looking at appointment processes. I know there's been some flux as the website changes, but it was never a particularly easy process to follow if you were a resident interested in getting involved. I will say the clerk is quite helpful if you have questions and you have the wherewithal to ask. But it's incredibly difficult to figure out when one ought to apply for what positions. It's further confounded because the policy that's in place isn't necessarily followed to the sort of like the letter of the way it's written. And that doesn't mean that, I guess I'm not trying to say there's ill intent involved there. I've been involved in city government. I understand that as you go through processes, sometimes things change. But the process as written requires a specific posting for each position that's open, and that be 14 days. In the past, it's been at least 14 days, sometimes more. But then applications for those positions can only be accepted during that time period. And that policy has kind of been stepped away from, which is okay if the council wants to go back and sort of review that policy and change it. But it does make it confusing. So I guess with regard to the policy, I just kind of have a couple questions. So like, having heard this, is the council intending to go back and use the policy as it's written? Is the intent to sort of continue to move forward as is without change to the policy, which creates confusion because there are actions that don't align with what's written. When you go to the website, you go to the website seeking information, that's the information that's there. But if it's not followed, that can be confusing for residents. Or would the council be have the intent to go back and look at that policy? It hasn't been reviewed in a while, to update it to maybe practices that the council is using right now, which actually creates sort of some confusion for some of the currently upcoming positions. I saw that Mr. Barrow was appointed, so that will leave specifically on the planning board. It looks like 2 positions open. The planning board was the only board that was actually advertised per the policy. So I guess my question is like, what appointments is the appointment committee looking to fill coming up? When will that stuff be posted? Will the associate position be filled by reopening the position, the one that was declined? Will it be reopened and done in conjunction with the new position that's open? Or will the appointment committee go back and simply use the applications that were already handed in? Those folks that have handed in applications, do they need to hand in new applications, or will their applications carry? I guess when you look at the applications, they're stamped with when they were handed in, but then they also have an expiration date written on them. So my question is, does that mean that the application stays open until the expiration date and would be considered during any appointment committee meeting, or does a resident need to go and like redo an application? And if someone were to apply for a position now, because there are several vacant positions open that are indicated as vacant but aren't advertised as being taking applications for an upcoming appointment meeting, if someone were to apply to those, does that application stick until the appointment committee meeting, until the appointment committee meets to fill that position? Or is it really only, I don't know, like 30 days before the appointment committee is going to meet? Or is it that 14-day posted period? So there's just some, it is more confusing now to follow, and it was never not confusing to begin with. So those are some questions I have for the council just to consider.
So, Mr. Sear, I can't offer an opinion at the moment about the council reviewing the policy, but to your questions about the current application process, and Clerk Carrington will rescue me here if I drive off the side of the road as I answer this, but my understanding would be that relative to the planning board positions that you mentioned, that there are 2 associate positions, those pursuant to the policy will have to be advertised and brought forth to the appointment committee anew. Prior applications are only for the period in which applications were open for earlier appointments. So if one wanted to apply again, they could submit, the application doesn't have to change. You could submit the same application again. Once the clerk sets the website to apply, applications are taken, and anyone applying through that method, their applications are considered up until the time that the clerk closes applications, which I don't know the exact number of days, but is some number of days prior to the appointment committee meeting to meet the notification guidelines. I think that answers the questions that I wrote down, but if there's further questions, the clerk, I'm sure, would be happy to answer any other questions that you might have about the process. Go ahead, ma'am.
Good evening. My name is Pat Ray, and I reside at the J. Lynn Trailer Park, 1350 Turner Street, Auburn. And I would like to mention that I have been a resident of that park since 1980, over 45 years. And I have seen that go from a beautiful park to one that's broken down, dilapidated, in bad need of repair in more ways than one, like roads, water, and sewer. And it also needs more security. I'd like to see lights put back on in the park to make us feel more secure. And I find that their rules are way too strict on many things. I've seen people evicted for minor things such as skirting being down on the ground and not being put back by their deadline. And I just think, all in all, it's not fair, particularly to senior citizens on fixed incomes. I would like for City Council to advise me on something that I'm not clear about. And that happens to be, wasn't a 2-year rent freeze on the books to be approved? The reason I ask, because we had 2 rent increases in the year 2025 at our trailer park in January and again in September to beat, so to speak, the freeze on rents for 2 years. What happened to that? Can anybody tell me?
So there is no current, nor has there been, that I'm aware of, any type of a freeze on rents at the city level. I think some municipalities around the state, a few may have done this. Currently, the restrictions on the timing of rent increases is in state statute. But it's, my understanding of the statute, it's not a freeze. It regulates the amount and timing of rent increases.
Well, RCM managed to get a rate increase, and our rent went up $100 effective October 1st. So that made 2 rent increases within a 12-month period. That's outrageous.
So my suggestion, ma'am, and to the other folks, if you had, I believe September 23rd was the date that legislation, non-emergency legislation passed by the first regular session of the legislature took effect. And if there were rent increases after that date, then I would highly recommend that you seek some type of legal assistance. Pine Tree Legal and such entities might be available to you. But there is no, I'm not aware of any actual freeze, only the new state statute that took effect controlling the amount and timing of rent increases.
Is it still a possibility that the rent freeze will come into effect? Is it to be revoted on, or is it dead in the water?
Well, I wouldn't be in a position to look in a crystal ball at what the legislature might or might not do in the future. Certainly the issues around the concerns in the trailer park have been brought forth by Councilor Randall and Councilor Duval, and there is some discussion going on with legal counsel about the applicability of the state statute and what leeway the city may or may not have to bring matters in front of the council to address the concerns that folks that live in the 3 trailer parks have raised. So
I just don't think it's fair. I mean, we need to show compassion for each other, not just bleed us to death. And That's my opinion.
Yeah, thank you very much. If there's any other member of the public who'd like to address the council, please approach the podium or provide your name and address.
Good evening, council members. My name's Sharon Dickinson, and I live in J. Lynn Mobile Home Park, and I own my home. And I'm not a public speaker, but my rent was raised, I'm very low income, and my rent was raised $100 since, well, in a year. And that's just too much on living like I do on so little. And from what this says, Waterville has a moratorium on their rent increase? And Brunswick?
That's correct.
Oh, okay. So that's what we're asking for, is a moratorium?
Yeah, so just to help provide some clarity to the folks that are here regarding the trailer parks, we certainly understand the desire for a moratorium. Whether the city can legally, at this point in time, enact a moratorium is a question that has been raised by Councilor Randall and Councilor Duval, and the city manager and I have made this question, posed this question to legal counsel. There are legal restrictions on being able to apply moratoriums of a whole variety of types, and the issue here is that the moratoriums from some of these other communities were enacted well before the state legislation that has rent control took place. So it's unclear, and we're expecting in the next week or so to get guidance from the city attorney on whether the council even has the authority to apply a moratorium. If they do, I'm sure that it'll come before the council. Councilor Randall and Councilor Duval have raised a number of issues, many of which the folks are testifying about here tonight. Okay. And that also may lead to some type of action to come before the city council.
Okay. Okay, thank you.
You're very welcome. Is there anyone else from the public that would like to address the council? Please come forward to the podium.
Yes, my name's Frank LeClaire. I'm a resident of Washington Street Trailer Park, and we've experienced rent increases of over $100 in the past 6 months, and I'm hoping that the council will consider a moratorium and help us out, because we definitely do not have any other place to go. And we're under pressure or stress that we will be priced out of our homes and become homeless. And the pressure is serious to all of us. And I wish the council would consider taking action. Thank you.
Thank you, sir. Does anyone else who'd like to address the council, please step forward to the podium? Not seeing any, the open session is closed. We'll move on to unfinished business. The first item is ordinance 08-1215-2025, amending the city's Code of Ordinances, Chapter 52, Traffic and Vehicles, to update the designated winter relief parking areas. This would be for second reading and public hearing. Is there a motion?
Motion to approve.
Moved by Councilor Walker. Is there a second?
Second.
Seconded by Councilor Cowan. Is there's any member of the public that would like to address the council relative to this ordinance change, please approach the podium and provide your name and address. Not seeing any, the public hearing is closed. Discussion by the council. Is the council ready for the question? The vote will be by roll call. The clerk will call the roll.
Counselor Cowan?
Yes.
Counselor Duval?
Yes.
Counselor Butler?
Yes.
Counselor Walker?
Yes.
Counselor Platts?
Yes.
Counselor Gary?
Yes.
Counselor Randall?
Yes.
7 having voted in the affirmative and none in the negative, the motion is adopted. We'll move on to new business. The first item is Order 1001052026, granting Full Plate LLC DBA 7 Jam Kitchen at 550 Center Street, Unit 1234, an on-premise liquor license. Is there a motion?
Motion to accept.
Moved by Counselor Walker. Is there a second?
Second.
Seconded by Counselor Duval. If there's any member of the public that would like to comment on this liquor license application, please approach the podium and provide your name and address. Not seeing any, public comment is closed. Discussion by the council. Counselor Gary.
Thank you, Mr. Mayor. Since this is a new business or one that I have not heard of, can somebody from the audience or planning and permitting give us a brief synopsis of what this is, where they are, and what they serve?
I think the answer to that is yes, someone can. If you could give your name, sir, and your association with the business.
My name is Kevin Gay. I'm the chef owner of the property, 550 Center Street in the Auburn Mall, the old Papagino's. What I would like to do is we're starting upscale breakfast restaurant. Our starting hours are going to be 7 to 2. We're going to start with 4 days a week because it's a small operation. I'm going to be doing most of everything myself. And until we get up and going and start generating revenue and I'm able to hire more staff, the hours will expand, hopefully to 7 days, and then we'll open for dinner. The alcohol is not what we're looking to serve to make the money. We'll be starting with mimosas and like simple Bloody Marys, just something to accentuate the food. It's not anything that we're like a party type atmosphere. It's just something that we think our guests would like.
Thank you. Any questions for the applicant? Thank you very much, sir.
You're welcome. Thank you, sir.
Any further questions from the council? Council ready for the question? The vote will be by show of hands. All those in favor? Opposed? 7 having voted in the affirmative and none in the negative, the motion is adopted. The next item is Order 1101052026, approving the temporary liquor license for an incorporated civic organization for the city's 3 2026 signature events, the Auburn Lobster Festival, the Auburn Blues and Brews, and New Year's Auburn. Is there a motion?
Motion to move.
Moved by Counselor Walker.
Second.
Seconded by Counselor Cowan. Is there any member of the public that would like to address the council relative to this liquor license application? Please approach the podium and provide your name and address. Not seeing any, public comments closed. Discussion by the council. Council ready for the question? Vote will be by show of hands. All those in favor? Opposed? 7 having voted in the affirmative and none in the negative, the motion is adopted. The next item is Ordinance 0101052026, recommendation by the Auburn Planning Board pursuant to Chapter 60, Article 17, Division 2, amendment to the zoning ordinance or zoning map to rezone airport-owned airport-owned land from suburban residential, parcel ID 156-015, to the industrial zone district. This will be for first reading and roll call vote. Is there a motion?
Motion to move.
Moved by Counselor Walker.
Second.
Seconded by Counselor Cowan. If there's any member of the public who'd like to address the council on this item, please approach the podium and provide your name and address. Not seeing any, public comment will be closed. Discussion by the council. Counselor Platt.
I just had I'm curious, does anyone know, are there any abutters to this property line? Is there anyone going to be affected by this change? It's not necessarily outlined in the brief. Any individual homeowners?
So Mr. Labonte's here, if he wants to come forward. I don't believe there's going to be adverse impact. One of these parcels is a split parcel. It's partially industrial now, and the other half was a strip zone. And the other is a former residence that the airport now owns the property. But do you have anything to add, Mr. Labonte?
Yeah, the property that's currently the motion, often called the Roundy House, that has frontage on Hotel Road, was addressed to Constellation Drive at the time that the family owned that. And the residential portion was zoned residential. The remainder was zoned industrial, since he was running a commercial operation as well. The airport acquired it and never facilitated a request to the City of Auburn to rezone that property. So in terms of impact, the city went through the notice process, so abutters within a certain perimeter were provided notice. I don't believe, I was at the planning board hearing, there were no public comments there. Certainly folks that aren't currently abutting an industrial zone will now be abutting an industrial zone, but no other direct impact.
Any other questions or comments from the council? Is council ready for the question? The vote will be by roll call. The clerk will call the roll.
Counselor Duval?
Yes.
Counselor Butler?
Yes.
Counselor Walker?
Yes.
Counselor Platts?
Yes.
Counselor Gary?
Yes.
Counselor Randall?
Yes.
Counselor Cowan?
Yes.
7 having voted in the affirmative and none in the negative, the motion is adopted. The next item is a related item. It's ordinance 02-0105-2026, a recommendation by the Auburn Planning Board pursuant to Chapter 60, Article 17, Division 2, amendment to the zoning ordinance or zoning map to rezone airport-owned land from low-density country residential, partial ID 107-011, to the industrial zoning district. Is there a motion?
Motion to move.
Moved by Councilor Walker.
Second.
Seconded by Councilor Duval. Does any member of the public who'd like to address the council on this item, please approach the podium and provide your name and address. Not seeing any, public comment will be closed. Discussion by the council? Council Platt.
I'd just like to ask the same question for the record, just to make sure we're doing our due diligence here. Are there any properties directly affected by this zoning change other than city-owned properties?
No, this was a property, just for context, this was actually originally owned by the Auburn Business Development Corporation as part of their larger business park development now Cascade Drive. This property was acquired by the airport, similarly wasn't applied for a zone change. Abutters in that case, again, within the appropriate perimeter were noticed. This parcel sits in between Foster Road and Kitty Hawk where the approach lights are. This is not an area other than the approach light infrastructure would ever change.
Any other questions or comments by the council? Council ready for the question? Vote will be by roll call. The clerk will call the roll.
Counselor Butler?
Yes.
Counselor Walker?
Yes.
Counselor Platts?
Yes.
Counselor Gary?
Yes.
Counselor Randall?
Yes.
Counselor Cowan?
Yes.
Counselor Duval?
Yes.
7 having voted in the affirmative, none in the negative, the motion is adopted. The next item is Order 120105-2026, rescinding Order 610707-2025 regarding directing the Maine Waste to Energy Board representative. As background on this, this was an order previously enacted by the council that required consultation with the council before the casting of any votes related to certain financial matters. There has been some changes at Maine Waste to Energy, and I'm recommending that this be rescinded. While we still have issues that we're working through at Maine Waste to Energy, this particular restriction doesn't appear to be needed any longer. Is there a motion?
So moved.
Moved by Councilor Platt.
Second.
Seconded by Councilor Cowan. If any member of the public would like to address the council on this item, please approach the podium and provide your name and address. Not seeing any, public comments closed. Discussion by the council. Councilor Walker.
Yeah, could you tell me what the advantage or the reason that we should vote for this to be changed after it being there for approximately 6 months. I was there that whole time. I don't see that we used it or didn't use it, but it was an emergency to get it into effect. And now all at once, it seems like it's not needed anymore. So what benefit is it to the city to change it again?
Well, I think that the issues at hand earlier, or I guess later in last year now, since we're in 2026, had to do with certain financial issues and requests for monies from the various member communities by the board. At this point, I think that issue has been resolved. Legal has advised us that those requests were not valid, and the board is now about to come forth with their next year's budget. They're required by the interlocal agreement to provide budget to the city by February 1st. So I think that those transitory issues that were in front of the body in the fall will be wrapped up in this budget.
So I guess, does this give an advantage to somebody else to do something different than we had in the past?
No, I think this is, I'm not sure I understand it. I don't think it gives an advantage or a disadvantage. This is returning to the manner in which the city interacted with Maine Waste to Energy for many years.
So it's going back to the original agreement, I guess, that the cities and towns have with Waste to Energy.
Well, yes, I don't think that this order changed in any way the relationship between the city and Maine Waste to Energy. This had to do with the action by the city's representative relative to financial matters at the Maine Waste to Energy board meetings. And this is returning to the way that this has been done in the past.
So I guess I'll ask the other question. Why weren't we notified that whatever it was we supposedly did, that we couldn't do or shouldn't do or didn't do? I came to you and the city manager, which I think the city manager runs the day-to-day operations around here. I'm not sure that the mayor-elected runs them operations, so I always dealt with the manager. And back then, he told me whatever it was we needed, we were doing it correct. That's why I came to him 8 months ago, probably 9 months ago now. And everything seemed to be going and flowing pretty well until, I guess, I saw what was writing on the wall. I wasn't born without a brain. I knew when you passed this back 6 months ago, 7 months ago, that you didn't like the way I voted out there. The thing was, with the way there that they told us that the City of Auburn was going to pay a bill that they had that was outstanding, just like all the other towns, we were the only ones to object because the ownership that we have means that we have a lot more trash coming in. So that makes us, at whatever it is, 51, 52, 59% ownership. It's still only one vote when we cast a vote as an executive board out there when it comes to passing on the bills that can't be paid because there's not enough money in the kitty to pay the bills. Now, not everybody knows what the regulations are within that contract of everybody within the towns and cities. There's 12 of them that are involved in this. Only one had a problem with trying to come up with the option that would work because of the request over and over and over And we tried our best to give the city of Auburn what they wanted in writing. We tried our best, I tried, at least my best, to have the city manager that runs the operation day to day around here to communicate with the director of, which is no longer there, the director of the waste to energy. Things went pretty good for a while, and then for some reason they went to the left or to the right. I don't have all the answers of why it did, other than they felt, these two gentlemen right here felt, that we weren't giving them the correct answers or the right answer somehow. We felt that we were doing that, and we felt that we were being honest, straightforward. The other people that are a part of the executive committee voted to just send the bills. Send the bills. Phil Crow, as the city manager of Auburn, said, send the bills. When we get the bills, maybe we can pay the bills after the operation, whatever. We did that. The attorney that heads us out there, which is not the same as the city's attorney, said, you have done your best, send the bills. Well, apparently we didn't do our best, did we? Because the city manager didn't talk to me too much anymore about it. Our elected mayor decided to appoint somebody else, and now he wants to change the rules back to the way they were because he's appointed Phil Crow, which is the city manager of Auburn, which could have been on there at any time. He didn't have to wait until December to do it. But again, because he didn't get his way, meaning the mayor, took me off because that was his way of saying to Mr. Crow, whatever I want, you're going to give me. So that's where we are at this point. Like it or not, that's exactly where we are.
So in response to that, I would say to the members of the council that there's significant issues at Maine Waste to Energy. The city manager and I have had frequent consultation with legal counsel. If I were to summarize it, the city of Auburn has yet to receive any complete and accurate financial statements from Maine Waste to Energy that would allow the city of Auburn to spend substantial amounts of taxpayers' money without appropriate backup. That whole discussion is beyond the scope of this order that's before us. The council's well aware that there will be additional executive sessions forthcoming with legal counsel about the matters related to Maine Waste to Energy. This matter that's before the council is very narrow in that it rescinds the prior order that requires a vote of the full council before casting a vote at Maine Waste to Energy and returns this to the method that we had used for a number of years. Is there any other questions or comments from the council? Councilor Randall.
Is there any harm in leaving the rule in place for now and trying to change it again later if necessary, or is it something that needs to be rescinded right now?
From my opinion, it's something that needs to be done because we're in a different place with Maine Waste to Energy, and we're now at a point where they're about to propose a annual budget that should provide the board's strategy to fix the financial difficulties that they have, and it's going to be necessary to have our member vote at those meetings to get this before us in the time frame allotted in the interlocal agreement, which is unlikely to be met if we have to circulate this all back through the council at this point. Other questions or comments? The council ready for the question? Vote will be by show of hands. All those in favor? Opposed? 4 having voted in the affirmative and 3 in the negative, the motion is adopted. We'll move on to reports. Just a couple quick items. Appreciation to Public Works for their response to the first two storms of the season. We seem to get hit with very difficult storms and challenging conditions. And I think under the conditions presented, they did a really good job in taking care of the plowing and sanding and salting. And I'd like to thank everyone that was involved in New Year's Auburn. It was a very successful event. Thanks to our community engagement, communications folks that managed the event, Public Works for a large amount of work to get things set up and prepared, and the Police and Fire Department for providing safety coverage at the event. With that, Councilor Geary.
Nothing at this time.
Councilor Randall.
Yes, thank you. I just briefly want to acknowledge the public comments that we heard today from the citizens who came worried about their rent increases. I want to thank them for doing that, because it took a lot of bravery to get up here and point out their vulnerabilities within society. And for some of us, this may have been the first time hearing these concerns in person, but it's my belief the issue is worthy of our attention, and one where time matters. And it's my hope that we can continue this conversation and give it the thoughtful consideration it deserves. Thank you.
Thank you. Councilor Cowan.
Nothing this evening.
Councilor Duval.
No, nothing beyond what Councilor Randall has mentioned.
Councilor Butler.
I wanted to mention that next Wednesday, the 14th, the airport will have an open house to review their master plan, and that's for the public as well as for the city council members.
Do you know what time and location?
Sure, at the airport. 4:30, I believe, is when it begins.
And it's at the airport conference room?
Yes, right at the main.
Great, thank you.
Sorry, don't have the
That's
language
fine.
yet.
Councilor Walker.
Nothing at this point.
Councilor Platt.
Just a reminder that there's an upcoming school board meeting on Wednesday the 7th, as well as newly posted minutes for the Auburn Middle School Advisory Committee meeting that happened on December 17th, addressing the movement of the 6th grade to Auburn Middle School. Those minutes are available on the school department website.
Yes, Councilor.
Thank you, Mr. Mayor. May I ask, through the chair, to the our school representative, can you please find a way that I can be put on the notices of the no school today or delays? I know I don't have kids, but there's always somebody that calls me, and I have to try to chase on TV on my cell phone or try to chase the website so I can call this person back. So I'd appreciate it if you could find a way to add me.
I will reach out to the superintendent and/or the IT department for the school to see if that's possible. I'm sure it is possible. I think we can do that.
Thank you. Mr. Manager?
Thanks, Mayor, Council. Just for the public, you'll be receiving a mailing either today or tomorrow. Should have been in your boxes from the Community Development Department related to a survey pertaining to HUD funds and how those should be spent in the community. We've had great responses in the past, so it'll be a postcard that'll be in your mailbox, and please participate. Thanks.
With that, we'll move on to the second open session of the evening. If there's any member of the public who'd like to address the council on items not on tonight's agenda, please approach the podium, provide your name and address. Welcome.
Oh, hello. Steve Milks, 82 Alderwood Road. I got here a little late tonight, which was kind of nice. I was watching basketball, but wanted to thank the mayor for his, I listened to the workshop summary of the needle exchange program, the dissension. I thought it was a fair summary, so I wanted to thank you for that. Just wanted to clarify what my position a little bit more, in that it is, I want to make sure that I'm clear that my feelings on this, and also I've been asking people in the city, random people, taking a subjective poll, so take it for what it's worth. I haven't heard anybody say it's a good idea to have a needle exchange program. But more specifically, my position is that it is not kind or compassionate or humane to give somebody the tools of their demise. I fully believe that the people that are involved in the program and that believe in it are good, kind people that are trying to do the right thing, but there's no evidence that it improves quality of life of the person that's getting the needles or the citizens of the community that they're in. And if we want to do something for the people that are affected by drug addiction, which I do know something about, and the community, everything we should be focused on is the recovery and programs, and we should be talking about how do we help people become clean, not how do we, someone's drinking, you know, I'm an alcoholic, 14 years, sober. I'm drinking a bottle of the most rot gut whiskey that's going to rot my stomach out. And you come up to me and say, oh, let me help you. Here's some clothes, here's some Maker's Mark. Here's some nice high-end whiskey for you to drink. Let me take that stuff that's going to rot your stomach. We're giving people the tools of their destruction. And it's not humane and it's not the right way to address this issue. We should be talking about recovery. We should be talking about mental health and how we get people that are not capable of taking care of themselves, get them the help in a hospital. I realize that there's a lot of cost and things to that, but we are taking time to talk about teaching kids that if you're going to be a drug addict on the street, we're going to give you needles so that you can do it more cleanly. That's what we're showing children. That's the message we're giving to our youth. And we should be telling them that we would like to help them and doing things that are going to allow people that can't take care of themselves. Some people are mentally ill and not capable of taking care of themselves. How are we going to do that? And then dealing with the rest of people that are in that disease. And so I just want to make sure that I was clear on my position, and I'm passionate about this, and I appreciate the time, and thank you for your summary.
Yeah, thank you very much. Is any other member of the public who would like to address the council? Please approach the podium. Not seeing any, the open session will be closed. The council will have an executive session. No action is expected to follow. The council expects to adjourn as soon as we come out of executive session. This will be an executive session pursuant to 1 MRSA Section 405-6D for labor negotiations regarding police department patrol. Is there a motion to go into executive session?
So moved.
Moved by Councilor Cowan. Is there a second?
Second.
Seconded by Councilor Butler. Vote will be by show of hands. All those in favor? Opposed? 7 having voted in the affirmative and none in the negative. The council will be in executive session.